Heart disease is a silent killer, often developing quietly over time without noticeable symptoms. The reality is that heart disease is the leading cause of death worldwide, and many individuals, especially seniors, don't even realize they are at risk until it's too late. As the disease progresses, the signs become clearer, but often by this point, irreversible damage has already occurred. You might think of heart disease as something that involves obvious symptoms like chest pain, but the truth is much more subtle. In its early stages, the symptoms may seem mild or completely unrelated to heart problems. For example, fatigue, mild shortness of breath, or even swelling in the legs might all seem like inconsequential issues, something you can chalk up to aging or simple fatigue. However, these can be the hidden signs of heart disease. Many heart conditions develop slowly over time, and by the time the symptoms become severe enough to notice, the condition is often far more serious than you could have imagined. That's why early detection is crucial. In this video, we will explore 3 major warning signs that could indicate hidden heart disease, dive deep into the medical reasons behind them, and provide real-life examples of people who experience these symptoms and how they manage to address them early. Before we start, remember to hit the subscribe button and turn on notifications so you don't miss any valuable information about keeping your heart and body in the best condition possible. Understanding heart disease. An overview. What is heart disease? Heart disease is a general term that refers to several conditions that affect the heart's function and structure. The most common types include coronary artery disease, COAD. This is the narrowing or blockage of the coronary arteries, which supply blood to the heart muscle itself. The narrowing is typically caused by a buildup of plaque, consisting of fatty deposits, cholesterol, and other substances. Heart failure. This condition occurs when the heart is too weak to pump enough blood to meet the body's needs. This results in fluid buildup in the lungs, legs, or abdomen, leading to swelling and shortness of breath. Arrhythmia. An arrhythmia is an irregular heartbeat, whether it's too fast, too slow, or an abnormal rhythm altogether. This can lead to a variety of issues such as dizziness, shortness of breath, or even sudden cardiac arrest in extreme cases. Valvular heart disease. The heart contains 4 valves that help regulate blood flow. If these valves become damaged or diseased, blood flow can be disrupted, leading to additional strain on the heart. Each of these conditions has its own set of symptoms, but they all share one thing in common. They interfere with the heart's ability to pump blood efficiently. The symptoms of these conditions are often subtle and develop gradually, meaning many people might have heart disease for years before they even realize it. Why is heart disease so dangerous? What makes heart disease especially dangerous is that its symptoms can be misleading or overlooked entirely. Many people dismiss mild symptoms like fatigue or swelling as just part of aging or nothing to worry about. But these small signs can be indicative of a much more serious underlying issue. Moreover, heart disease is progressive. That means that, if left unchecked, a minor issue can eventually develop into a life-threatening condition. This is why understanding the warning signs and acting quickly is so critical. With the right knowledge, you can take steps to slow or even reverse the progress of heart disease. Warning sign number 1. Unexplained fatigue. What is fatigue? Fatigue, in the context of heart disease, refers to an overwhelming sense of exhaustion that is not relieved by rest. It's different from the occasional tiredness we all feel after a busy day. With heart disease, fatigue is a persistent condition that affects your ability to perform everyday activities. It might appear suddenly or gradually, but in either case, it indicates that something isn't right with your heart. How does fatigue relate to heart disease? Fatigue is one of the earliest symptoms of heart disease, but many people don't realize it. The reason is simple. The heart is not pumping enough oxygenated blood to other parts of the body. When blood flow to the muscles and organs decreases, those areas do not get the nutrients and oxygen they need to function properly. As a result, the body starts to feel fatigued, and even basic activities like walking or climbing stairs can feel exhausting. This fatigue occurs because the heart has to work harder to pump blood through the body, especially if there are blockages in the arteries or the heart muscle itself is weakened. As the condition worsens, the fatigue becomes more pronounced, often making it difficult to even get out of bed in the morning or complete simple tasks. Expert insight. Dr. Michael Smith, a cardiologist specializing in heart disease, explains, fatigue is often one of the first symptoms we see in patients with heart disease. Unfortunately, many people think of it as just normal aging, so they don't bring it up to their doctor until it becomes severe. Early recognition and intervention can make a huge difference. What to do? If you experience unexplained fatigue, seek medical advice. Fatigue that doesn't improve with rest should not be ignored. A thorough evaluation by your doctor, including a physical examination and possibly an EKG or echocardiogram, can determine the cause of the fatigue. Monitor other symptoms. Keep track of any additional symptoms like shortness of breath, swelling, or chest pain that may accompany the fatigue. Lifestyle changes. Ensure you are getting enough quality sleep, managing your stress levels, and maintaining a healthy diet to support overall heart health. Case study. Sarah's story. Sarah, a 65-year-old teacher, began experiencing extreme fatigue that would not go away, no matter how much she rested. She had been feeling tired for months, but assumed it was just part of getting older. It wasn't until she struggled to finish a walk around her neighborhood that she decided to see her doctor. After undergoing several tests, Sarah was diagnosed with coronary artery disease. The blockage in her arteries was making it difficult for her heart to pump blood effectively, causing her persistent fatigue. Sarah was put on a treatment plan that included medications and lifestyle changes, which significantly improved her energy levels over the course of a few months. Prevention tips. Stay active. Regular physical activity is crucial to keeping your heart strong and ensuring blood circulates efficiently throughout your body. Eat heart-healthy foods. Focus on a diet rich in fruits, vegetables, lean proteins, and whole grains. Manage stress. Regularly practicing stress-relieving activities like yoga, meditation, or even deep breathing exercises can significantly improve your heart's performance. Warning sign number 2. Swelling in the feet, ankles, and legs. What is edema? Swelling in the feet, ankles, and legs, known as edema, occurs when excess fluid builds up in the body's tissues. While there are many potential causes for edema, when it's linked to heart disease, it typically means the heart is struggling to pump blood efficiently. The body compensates by retaining fluid, leading to visible swelling. How does edema relate to heart disease? In patients with heart failure, the heart is unable to pump blood effectively. As a result, blood backs up in the veins, causing fluid to leak into the surrounding tissues. This is particularly noticeable in the lower extremities, as gravity pulls the fluid downward, resulting in swollen feet and legs. This swelling is often more pronounced at the end of the day, after standing or walking for prolonged periods. It can be painful and uncomfortable, and in severe cases, it can make walking or even standing difficult. Expert insight. Dr. Linda Taylor, a heart failure specialist, says, edema is one of the most telling signs that your heart isn't pumping effectively. When the heart is weak, it causes a backup of blood in the veins, leading to fluid buildup. If you notice persistent swelling, especially if it gets worse by the evening, you should seek medical help. What to do? If you experience edema, elevate your legs. When you sit or lie down, try to elevate your legs to allow the fluid to return to the upper part of your body. Consult your doctor. If the swelling doesn't improve or gets worse, it's time to consult with your healthcare provider. They might recommend an echocardiogram or other tests to evaluate your heart's function. Exercise. Even light physical activity, such as walking or swimming, can help improve circulation and reduce swelling. Case study: Mark's experience. Mark, 70, noticed that his feet were becoming increasingly swollen after long periods of sitting at his desk. He attributed it to poor circulation, as he had been sitting for hours. However, over time, his legs began to feel heavy and he started having difficulty walking. After a visit to his doctor, Mark was diagnosed with heart failure. The weakening of his heart muscle had caused fluid to build up in his legs. By following a treatment plan that included medications and daily leg elevation, Mark was able to reduce the swelling and regain his mobility. Prevention tips: limit sodium intake. Excessive salt can contribute to fluid retention, so try to limit your intake and opt for fresh, whole foods. Stay active. Regular exercise can help improve circulation and reduce swelling. Monitor your weight. Rapid weight gain can be a sign of fluid buildup and should be discussed with a doctor. Warning sign number 3. Pain in the jaw, neck, or shoulders. What is angina and referred pain? Angina refers to chest pain caused by reduced blood flow to the heart muscle. While it's typically felt in the chest, it can sometimes radiate to other areas, like the jaw, neck, shoulders, and even the back. This referred pain occurs when the heart muscle is deprived of oxygen, causing discomfort in other parts of the upper body. Why does this happen? When blood flow to the heart is compromised due to blocked arteries, the heart doesn't receive enough oxygen. As a result, pain can radiate to other areas connected to the heart through nerve pathways. This referred pain is one of the most important warning signs of heart disease, but it is often overlooked or misattributed to other causes, like stress or tension. Expert insight. Dr. Amanda Clark, a cardiologist, explains, referred pain can be misunderstood as something like a muscle strain, but in reality it's often a symptom of heart disease. The pain may feel like a dull ache or pressure, and it can appear in places you wouldn't expect, like the jaw or shoulder. What to do if you experience this pain? Don't ignore it. Pain in the jaw, neck, or shoulders should never be dismissed as simple muscle tension. Seek immediate medical advice. Keep track of the symptoms. Write down when the pain occurs, its severity, and any other accompanying symptoms, such as shortness of breath or dizziness. Case study: John's close call. John, 58, was having an unusually tight sensation in his shoulder one evening while watching TV. He assumed it was just stress from work, but as the discomfort worsened, it spread to his neck and jaw. He felt dizzy and a bit out of breath, so he called an ambulance. At the hospital, John was diagnosed with a heart attack. The chest pain he had been feeling was actually referred pain, signaling that the blood flow to his heart was severely restricted. With quick treatment, John was able to recover and reduce the long-term impact of the heart attack. Prevention tips: manage stress levels. Chronic stress can increase the risk of heart disease and trigger pain episodes. Practice relaxation techniques like yoga, meditation, and deep breathing. Stay active. Physical activity strengthens the heart and improves blood flow. Monitor your cholesterol and blood pressure. Regular screenings can help identify risk factors for heart disease. Conclusion: heart disease is often called the silent killer because it can develop without obvious symptoms. Recognizing early warning signs such as fatigue, swelling, and referred pain is crucial in preventing more serious complications down the line. By staying aware of these signs, seeking medical advice early, and making heart-healthy lifestyle changes, you can significantly reduce your risk of heart disease and its devastating effects.